very medial, okay? The multifidus muscle runs the entire length of your spine from L4, 5, all the way up to C2, 1, okay? It is most broad and prominent in the sacral spine and lumbar spine, lower lumbar spine, and then it kind of narrows into a very thin muscle that runs the length of the rest of the way, okay? So what we're going to do is we're going to locate the multifidus muscles between the spinous processes and the transverse processes of the lumbar spine, and particularly at the levels L3, L4, L5, as well as lateral to the spinous processes of the sacrum, okay, S1, S2, S3, okay? The multifidus is deep to the erector spinae aponeurosis, but there is no overlying muscle, okay? So when you ask the person to contract the multifidus muscle, and you feel the muscle bulge up underneath your fingers, you can be very sure that you're on the multifidus muscle. It comes back to the pictures from before. So here is the multifidus. If we remove the erector spinae and the aponeurosis, it's very thick and broad in there, okay? But remember from our previous pictures, all of our erector spinae muscles stop before we get this low down. And the quadratus lumborum, conversely as well, only out to the transverse process, and it's in this lateral section. So as long as I'm medial to the transverse process and in this deep recessed section here and in this section of the sacrum, I can be very sure the only muscle that's there is the multifidus. This is where knowing your anatomy, where things attach, begin and become so important, okay? So again, I just go back to my palpations like before. I can find what I think is his L4, L5, you know, and then I can come just lateral to those. I want to be between the spinous process and the spinous process and transverse process. And then Garrett, just again, can you lift your legs up for me? And that big, very thick, broad bulge that I feel deep to the aponeurosis tissue is going to be his multifidus, okay? I can go further down into the sacrum. Go ahead, lift up the feet again. And when I feel that bulge up, relax and lift up again.
Just
right
the heels,
there.
right?
Yep. Yeah, you can just do the heels too. Yep. Relax. And then lift up the whole leg if you can. Lifting up the whole leg makes it much stronger, but you can get away with just the heels there. But you got to feel, now this is where layer palpations become important. When I'm doing the erector spinae muscles, I'm just feeling very superficially and I'm not pressing so hard, especially when I'm on the aponeurosis. And when I ask him to pick his legs up, all I'm trying to feel for is that mild tension in the very top layer surface of the aponeurosis. But if I'm interested in the multifidus, I got to press through that a little bit deeper. I can feel, when you're superficial, your fingers slide very easily. When you're deeper and I'm trying to palpate in there, I can feel that texture of the muscle tissue deep to that aponeurosis, and I know that that's going to be the lumbar multifidus. I confirm it by having him contracted, okay? All right.